going around the world. Lots of people are going to be released as these sounds are listened to all around the globe. People have to see. Oh, insurance is like it's so covered from now until the day I see my your voice are shouting for from now. Shout it louder, people. From now. You do the next one. From now. One more time, they're all around me now. They're following me from now. Los solos de leche. The voices. Something clear around the wall. Jesus of people are going to be released as these sounds are listened to all around the globe. Speak on. Speak on. Oh, it surrounds me like this. It's no cover me from now until the day I see my it's the voice that shouts people. All watching from shouting louder, all watching from now. That's one. From now. All around me now. Yeah, boy, from what was you're surrounded, angels there. choices. Around the ball. So please walk with it as it sounds at distance. All around the globe. It surrounds me like it's so cover me from now until the day I see my your voice and shout for all of me from shouting louder for me. It's so cover me from now. The next one. From now. What I say, you're surrounded, angel.
Hello, everyone. Good evening. Good afternoon. Good morning, depending on where you're from. Hi, Sidonia. Hi. I can see family midwife. I can see Mousy is here, right? I can see yeah, family midwife and Mousy. Yes, that's comfort. And then family midwife. Thank you all. Just a few minutes for the others to join and then we can start. It's already streaming. It's already streaming live. So I've shared the live stream link in the chat. We can share it with our friends and colleagues, and then when we start, we can have them with us. I'll be using my other device to get the questions from online. Yeah. So let's wait for a few minutes. We have 5 people watching from here. That's what I can see already. Awesome. I think people will join in later. Okay, I think we have Winifred too here. Um, Let me try and get the others. Okay, I think we can start so that as we start, we can have the others join in later so that we don't run behind time. It's already some few minutes past, yeah, some few minutes past 1 p.m. Let me put it that way. So we'll start with doing some introductions. So in case you to introduce yourself, can you turn on your camera to make it more lovely? Because a lot of the discussions are going on here, but it's being streamed so that we get I'm also checking the live chat for our questions and all that. So in case there are any questions online and all that, I'll get it here. I can see Eunice. Eunice, thank you very much for being here online. I can see Eunice and 5 other people. All right. So let's start with our intro. So my name is Sada Sadiq. I'm the director for Midwifery GDNA. I'm also an international midwife currently in Saudi Arabia, and I'm passionate about maternal and newborn health. My focus is to make sure every pregnant woman is good and she goes home with her baby and the family and everyone is fine. Passionate about adolescent health, extensively to women's health as well. So that is why we are here today. Next to Sidonia, the kindly, how do I say? Kindly unmute yourself, turn on your camera possibly, and then introduce yourself for us. Hello, Sidonia. Or is anyone ready? Maybe
Hello,
Angelina, Mausi.
hello. I'm Sidonia.
Hi.
Sidonia, I'm a resident well woman specialist in training, passionate about adolescent and reproductive health. And for now, our focus for today is on the sensitization of HPV vaccination that Ghana is launching. And we are trying to break the myths around the vaccination and how we can get the public to understand why it's important for them to get their girls vaccinated. So I'll be around for any clarifications if I can. Thank you very much.
Thank you. Angelina, family midwife.
Hello, everyone. Good afternoon. Good afternoon. My name is Angelina Champomboache, a midwife and a well woman care resident at Ghana College, and with experience in reproductive health and maternal wellness. I'm also passionate about advancing women's health and preventive services, and that is why I'm here today to talk about HPV and then the vaccination, which is currently about to start in Ghana. And so we are privileged to be here. Whatever questions that you have, whatever education that you need to know in that, you are all here to assist to make it fruitful. Thank you.
Thank you very much. Mausi, Comfort, are you ready? Or Winifred?
Hello, good afternoon, everyone. I'm Winifred Boache, a midwife specialist in training, passionate about everything women health. We are here to contribute to our quota in preventing of HPV and then helping in the vaccination campaign as well. So we are here voices to the awareness creation so that we can all support women globally. Thank you.
Thank you very much. Um, Vicky, advanced midwife practitioner.
Yeah, yes. Hello, everybody. So I'm Victoria Tete, also a resident. So a specialized advanced midwifery in training. So when it comes to maternal and neonatal health, everybody will say, or our seniors will say, you should have a niche as a person, where you find yourself. You should have something that you are known for. So I think I am so very much passionate about maternal mental health. Compassionate care, we still have a lot to do. We still have a lot to do. And then also very, very much interested in mentoring. So I believe whatever capabilities that you have, whatever it is that you think you can do, if you are not able to give it to the next person, then you haven't done anything. Yeah, so these are many other areas, but then more of maternal and neonatal health. Thank you.
Thank you very much, Vicky. Comfort, are you ready?
Yes. Hello, everyone. Can you hear me?
Hi. Yes, please.
So, I'm Comfort, multi woman. I'm a registered general nurse and a trainer of trainers in cervical and breast cancer. I'm a nurse colposcopist and all said, you can see that I'm very passionate about taking breast and cervical into consideration. So I'm very happy that today we are going to talk about HPV, with a lot of death among women, or the second female in Ghana, as we are talking now. I'm very passionate and I'm very happy that I'm going to talk about this HPV. And happy also that very soon this month we are starting the vaccination of our young girls, which in future will cut down or eliminate entirely the cervical cancer.
Hello, Comfort.
Yes.
Okay, I thought I
Mhm.
lost you.
I'm here.
Okay, all right. Thank you very much. Thank
Mhm.
you. The line broke up, so I thought I lost you. So I think who has introduced Anne? Okay. Anne, can you please do a quick
Mm.
intro as we wait for Gifty and Miriam?
All right. Hello, all. I'm Ann Bonte. I am labor and delivery nurse in the U.S. here. Um, I am director of women's health for GDNA, and I also work with the Association of Women's Health Obstetrics and Nurses in the U.S. as their global health chair. So it's nice to meet all of you. Excited to talk about the HPV vaccine. And I know that it's something that they're rolling out in Ghana. In the States here, we've been having it for a long time. I'm approaching my mid 30s, and I got the HPV vaccine when I was 12 years old. So you can imagine how long we've had it here. And it's
Yeah.
been it's been very effective for preventing cancers here for women and men. So I'm excited to talk about it and give some good information about HPV vaccine. Thank you.
Thank you so much for the introduction from everyone. We'll start whilst others join, and as they join, they will blend in, and then we'll continue on with everyone. Well, so everybody is asking that why now? Where from this? Because already there are a lot of immunization given to children with vaccines. COVID came and a lot has happened. So people are wondering where from this all of a sudden. So that's what we are going to talk about. Thank you everyone. Those who are watching live, you can drop your questions in, show us some love. You can share for others to also join, especially the mothers and everybody who has been asking you questions on HPV and where they're gonna get it and all that. We're gonna break it all down today. So who do I start? I think I want to start with Comfort. She has done a lot of research into HPV and it's her specialty. She loves it, especially when it comes to cervical cancer and all that. Comfort. So what exactly is HPV and how is it different from other sexually transmitted infection? Oh, if you can turn on your camera, it would be lovely, but if you can't, no problem.
Thank you very much. As we are talking about HPV, that is also sexual transmitted infection. It is different from other sexual transmitted infection because this one causes cancer. Other sexual transmitted infections do not cause cancer and are treated. But cervical cancer, which comes from the STI of HPV, makes it different because it causes cervical cancer or causes other cancer. And the HPV that can everybody hear me? Hello?
Yes, please.
Yes, please, can be heard.
Okay. It's different because it causes cancers, not only cervical cancers as we always see, it causes many cancers and other diseases like what genital what. So it is different in its way for causing cancer. Why other STIs are treated when diagnosed and doesn't progress to cancer. Thank you.
Thank you very much. Thank you very much. This would go to Sidonia. Since most people with HPV don't have symptoms, they say, how can they know if they have it?
So as we said, usually it's repeated infection. So once you start getting repeated infections that you think are STIs, it's just like the female genital cystosomiasis that we are talking about. You should go for a checkup. And then others also bleed during and after sex is also another sign that we should look out for. And pain during sex. But most of the time,
Wow.
we turn a blind eye on is the repeated infections because with the HPV, when it starts, just like the FGS, I will be bringing in FGS because some people too are suffering from the FGS, not knowing that they have an infection because it's also comes like an STI. So how our cervix looks like. So once you start getting the repeated infection, you get in contact with the HPV virus and you don't go for a checkup or start treatment, it will start going inward. I'm saying this, I trying not to use a lot of medical jargons so that
Yeah.
our listeners would understand. So once it start going, it will spread out to all other parts of the. We start with the cervix, then it goes to the uterus, and it becomes a full blown cancer. It doesn't. One encounter with the virus when it's detected, usually they are able to treat and manage it for you, but repeatedly, and then others to think that the males do not get cancer, the HPV virus. They do get in contact with it, and there are those who even spread it. Those having, you can have,
Mm.
yes, through oral sex, you can give the woman the HPV virus. And for,
I see.
yes, during that contact, you may not actually feel anything as we are saying, but you start getting the discomfort, the discharges, the itches. And then if you just brush it away, you get another encounter, you are just accumulating it. So before you realize, it becomes something bigger than we can imagine. So any discharge we see, any bleeding we see, profuse smelling coming out of our genitals, we have to get to the nearest health facility, especially when you start getting repeated ones, getting pain, having bleeding after sex or during sex. All these things are cardinal signs that we should look out for so that we'll get ourselves treated early. My other colleagues would come in. And thank you.
Hello, can I come in?
Yes.
Yes, please. Comfort, you can come in.
Thank you very much. So your question goes like, how would somebody know if the person is having HPV infection?
Yeah.
Actually, if one is having the infection or one is infected with the HPV virus, there's no signs, there's no symptoms, there's nothing. So you will never know that you have a HPV infection until it tends to be cancerous or you have a pre-malignant lesion, like the starting of a cancer. Even when the cancer is starting and has not gone into cancerous stage yet, you will never have any symptoms because most people have the symptoms when it is now a cancer. But like having the HPV infection, like how we get um, malaria parasite in us, and some people may have the parasite in you, but you may not be having fever, you may not be having headache, but there's a parasite in you. That is how the HPV virus is. If you have the virus, you will never know, you will never have any symptoms until it tends to become cancer before you start having the symptoms of pains, bleeding, during breathing after sex, and then offensive vaginal discharge and all that. And then HPV infection, as my sister said earlier on, most of them are transient. In
Mm.
every sexual woman's age, we all have HPV. You definitely have or may have HPV infection, but about 90% of all the infection clears. It's about only 10% that does not clear. That leads to this cancer that is killing us. So if it were to be the 10% that is clearing and 90% is persistent, you can see by now all women are dead. So
Mm.
90%, 10% persist. So having the virus on its own, you will not have any symptoms until you have cancer, or you are in the way to have the invasive stage. You will not
Okay.
have any symptoms. That is why many women walk around with the HPV infection when HPV test is done, but no sign, no symptoms, or no beginning of cancer on their cervix. Because there are many women that when you take HPV samples, you run it. There are many women, many, about 90% are walking with their cervix looking very nice, no
lesion seen on the cervix, but the virus is there. It means that the virus has not started causing any abnormality. Even when you do pap smear, the cells will be normal, but the HPV is present. So it means that that HPV might clear, or if it's a persistent type, might now progress to a pre-malignant lesion before getting to the advanced stage.
Wow. Wow. This is quite
Yeah,
insightful. I
if I
mean,
can add.
Yeah, I wanted to add something
Oh, okay.
too. Oh, unless
okay.
Victoria wants to talk.
Yeah, so
Yeah.
and when you are done, then Vicky comes in. Gifty, we can see you.
Yeah, I just wanted to co-sign what Lady Comfort said that with HPV, there's usually many people don't have any signs or symptoms. Usually the infection clears naturally by the immune system, usually between like 1 to 2 years. But like she said, most people don't, unless like it doesn't clear, which is that 10%, like she was saying. um Most people will be carrying it without knowing it. So that's why it's very important to go for your routine pap smear exams. Go to your doctor or advanced provider, whoever you go to, if it's a nurse practitioner, midwife, or whoever, to get that screening. They usually take samples of your vaginal area down there and test for cancerous cells, HPV cells, and whatnot. Usually, if symptoms occur, which usually occurs when it has already turned into some form of cancer or close to it, usually the symptoms that come are genital warts. So warts is, it's like, to explain it in uh terms where it's not medical, it's like really, really, really small bumps that are grouped together. It looks like cauliflower or broccoli, like the head of it, but it's the color of the skin of the person. And it usually can occur on the vaginal area, or if it's a male, on his private area, his penis, his scrotum, his anus, and for women on her anus as well too. And usually there's no pain. It can be itchy, of course uncomfortable, because inflammation comes in that area where it's like, how do I say inflammation in an easy way, but it's basically uncomfortable. There's different types of warts that can occur, that can come down there. It doesn't all appear that way. Sometimes it can be flat. Sometimes it can come on the feet. It's not only on the private area, it can come on the feet as well. And you can feel it. It can come on the bottom of your feet, and it's often painful when you are walking or standing. um so it's these things, and other places also. I've seen it come on people's face, their neck, their legs. um
Really?
yes. So it's not only in the private area that it can occur. So that's why it's very, this thing is very tricky. And I believe that's why this cancer thing that has been killing women and men like crazy, and mainly a lot of women, is because when the symptoms even come chrono, the way it can appear, it can be very discreet, and it can appear in ways where it's considered not normal. So people won't know. Oh, especially if you are someone that when you work, you on your feet all the time. Imagine maybe a woman that sells things outside. She walks miles and miles all day. Naturally, on her mind, she's gonna think, "Oh,
Like
my
the
my
street
feet."
hawker?
Exactly. She's going to think naturally, oh, I'm on my feet all day. It's normal for at the end of the day, my feet is hurting, right? She's not going to think, say it's because of this thing. So it can cause so many things, so many, and when it progresses, it's not only cervical cancer, it can be anal cancer, that's cancer in your where you poop from, your butthole, cancer in your throat, your tongue, your tonsils, which is like it's a tonsils is a area in near your throat area. um you know so it's
Okay. Mm.
yeah, it's something. So the most important thing that people should know is that HPV infections are very silent. And so that's why it's important for all of us to raise the alarm that testing, regular testing, is very important. So that's what I had to add.
Okay, thank you very much. I don't know if Vicky, you still want to add something to
And
what
basically have
was said earlier, or
and basically have
she
dissected
said, well,
everything.
okay, don't worry, there are a lot of
But then I just
questions.
want to add that.
Don't worry, there are a lot of.
Hello,
Mhm.
can you hear me?
Yeah,
I just
yes,
want to add
please.
that it is not, this HPV is not only through sex. So they will say close contact, skin to skin contact. And yes, so even kissing, even touching someone. So they would literally will tell you that HPV is all over the place. You don't have to have sex or penetration before you say that, okay, I've had it or something. So it's everywhere. That is why it is so
So
common
what are some
all
of the
over.
other ways by which somebody can get it
Yes,
aside
so
sex?
sex, yes. So through, so kissing, because so far there's skin to skin contact, close skin to skin contact, when you are, licking somebody somewhere and all that. So yeah, so prefer this, your skin touches, come closer and touches someone that have it. Yes, that is why it is so common that you can't even understand. Like, it's so common. But the most maybe good thing about it is that it is one virus that also clears on its own. So it is when it's, as everybody have said, there's persistent infection, then it can, grow up to the cancer and all that. And yes, another way that you can see that you have it is, yes, Anne have said it, by going to test. So even you realize that when you go and test and you are positive, they will say, okay, come and test. Maybe you don't have any, there's no pre-malignant cells, anything, but then you test, the virus is positive. They'll say, come and test again in a year time, or whatever the healthcare provider sends fit. Then hoping that at that time it will go, or it would have cleared. Also, how can it clear? What one thing that can help it clear is you building your immune system. Yes, that is why when someone have HIV too, or when someone have the virus, or when someone is exhibiting some form of this what and all that, the next thing they will think about is, let's do HIV, because probably your immune system is also coming down, and HIV, we know, is one of the big things that bring our immune system down. So yes, they've said a little all, but then this is just more that I can add.
Okay, all right. Thank you very much.
Okay.
Um,
Since we're talking about,
Gifty,
can I add?
welcome. Do you want to introduce yourself? Oh, sorry. Let me
Hello.
let Gifty introduce herself, and I'll take something small from her. Hello, Gifty. Can you hear me?
Hello, Sada. Good afternoon, everyone.
Hi. Good afternoon.
Please, my name is Gifty Safo Anan. I am an oncology nurse specialist at the Tamale Teaching Hospital who is passionate about women's health and also a co-lead of GDNA Northern Zone. Thank you.
Thank you, Gifty. We were talking about um, whether, as and how some people do not see the symptom. But I want to come to my next question, and then probably family midwife and comfort can also join you on that one. I want to ask that, does a positive diagnosis always mean infidelity, or can HPV be, transmitted in another ways? I think Vicky started touching on it, and I would want you to take it. Then possibly comfort and family midwife wanted to add something to that one. So does it mean that if I get the virus, meaning I went to cheat, or I perform some sexual act or anything? Like, what does it mean?
Thank you so much. So it is not all the time that it means infidelity. Remember, we have other means that we can also contract the virus. That is through the use of animal syringes, use of public places, whereby people who are deeply infected with a disease, with a virus, goes to sit on it, and probably when you just go, you also sit on it. You can also take it from there. So it is not all the time that uh, an individual got it through infidelity. It is not all the time. Thank you. Hello?
Yeah, family midwife, go ahead, please.
Hello. I
Yeah.
also wanted to make some submissions on how the HPV is transmitted. As we know, we've already discussed, by my sisters have already made that, it's by skin to skin and then sexual contact. There are also, from other researchers and reading, that also shows that sometimes, which is less common, these things that I'm about to mention are less common. We have the auto-inoculation. That is, sometimes the virus will be on the person's skin or maybe the hands, and then whilst the person touches the genitals, it spread to that site. We also have shared sex toys, and now that we know about these other sexual identification, the LGBT, and even not like that, but now we have people using sex toys as a form of gratification, not necessarily being with the being married or so. And sometimes, out of ignorance or whatever, they shared sex toys. That one can also lead to you having the HPV. And then we also have these surfaces, what is the fomites transmission. Though other school of thought are saying that theoretically it's not possible, but then extremely unlikely in real life. So these are other forms of how the HPV is transmitted. Now, coming back to why, if somebody tests positive, does it mean that the person has been unfaithful, has cheated, or something of that sort? We have already heard from most of our sisters saying that the HPV stays in our body, and sometimes we don't even know because it doesn't show any signs and symptoms. And so what it means is it can be latent for months or years. That is, a person can acquire the HPV from a previous partner, and it may remain very dormant, like in the body, is undetectable and asymptomatic as well. Remember, we are saying that about 90% of us, in one way or the other, men or women, would definitely get the HPV, but then the immune system is able to fight against it. Okay, so it does not mean that once somebody tests positive, it means, oh, maybe Adiomansa went to cheat because HPV through sexual intercourse and that kind of thing. No, because it can be latent, and then it can be just dormant for years. And that is why we encourage the screening so that it can be detected early and then and treated as well. Also, it doesn't also mean that the test that we give or the test that we do, it doesn't detect the viral material. Okay, like it
Okay.
doesn't, yeah, it doesn't detect the viral material. So it's like it doesn't say when the infection occurred. I mean, most of us here that do the screening, like myself, like if you do It doesn't give you, it tells you the person is positive, but it doesn't tell you that, oh, maybe Antioquia had it in the year 1950 or 1920. Okay, so that alone should also, in our counseling to the clients, to debunk all these myths, you let the client know that it's because of how dormant that thing is, and she might have acquired it later on. But the test that you're doing is not going to tell you that you had it from this partner A or this partner B, or it does not necessarily mean that you had it through probably sexual intercourse or other means. So that's what I also wanted to add up to the question that was asked. Thank you.
Thank you very much. But I remember you wanted to say,
Um,
okay, Gifty
so
or
that
comfort you.
so
Yeah, Gifty.
so to add to that, the screening, that is why the screening we have the HPV DNA testing, which is where the analysis will be done by a pathologist. Then we
Mm,
have the VIA. So if you are doing the HPV DNA testing and is able to tell you that the strands that the patient is having, and we know that based on WHO requirement, before somebody will get a precancer lesion, when you do a VIA and it becomes positive, as she was saying, it takes 10 to 15 years. So if
wow.
it, yes, please. So if you do the HPV DNA testing and it comes out that the person is having the positive strands for either the ones that will cause cervical cancer or will cause what, so you can only guess that that means this person has the virus in her for between 10 to 15 years. So you can guess when the person started having sex. So sometimes when I do screening for people and it comes out as positive, I probe further to find out whether the time they had started having sex and all that. And even with the VI, I probe further to inquire. And sometimes you can know that from the time the person started having sex, possibly the person
Mm,
contracted it 10 years ago, 11 years ago, 12 years ago. Thank you.
wow. Thank you very much. Thank you so much. This is so
Director,
insightful. Yeah,
director.
comfort. Uh, okay, Angelina.
It's me. Yeah, please, I've been trying to reach Miriam, but her network, actually, she's moving from one village to the other in order to get a network to join us. But it looks like it's
Oh
becoming
my God.
unfruitful. So she said I should inform you that till she gets network, I don't think she can join. So she's very
All
sorry for
right.
you.
Okay, okay. Thank you. Thank you so much. All right. So now to our prevention and vaccination, which is comfort, you want to say something? I can see your
Yes,
mic is yeah, okay.
yes, yes.
Please add up, and then
Um,
today we want to
I have,
know everything about HPV before
okay,
any other thing else.
okay. So a little add-on I want to make is my sister who spoke about the transmission. She talked about the transmission, which are the some surfaces, fomites, and other ones. And I want to say that 90% of the transmission is sexually, and it's about
Mm,
only 10% that is asexually, which is not true sexual means. So
okay.
most of them are through sex, whichever means sex you have, whether orogenital, like mouth to genital, genital to genital, um, genital to anal, genital to manual, like the sex toys and things she talked about. Those are all forms of it. And then
Mm,
the other forms, which are the non-sexual means, even you can get it from animal bomb syringe that we use. Because
see,
this
those
HP,
that have been sharing Bentuano.
yeah, eventually, I say back only
Yes,
for 8,000.
yes.
You are using only one animal bomb syringe because you don't know what you are taking out from somebody's anus to somebody's anus.
And sometimes when
Wow.
I think about it personally, female, anytime that the concussion goes in, some even wash down into the vagina.
Mm.
There are many times I've seen a lot of children, both boys and girls, 9 to 11, 10, 7, who are having what? Genital what? I've seen a lot.
Wow.
So the HPV is not for only adults. Children also get. And what are the means that they
Mm.
also get it from? Some have it in anal, some have it in genital. Some may even take it from their parents, especially the low risk. HPV that we're talking about, we have two. We have low risk and a high risk. And the high risk are those that causes the cancer. And the low risk are those that causes the genital warts and then the actinata, condyloma, and all these. So
Wow.
because I didn't see somebody who is having cancer on the cervix and at the same time having the HPV virus that is causing the cervical cancer on the finger, one of the fingers. We just sampled it to see why there's unhealing wound on your hand. And the same finger, the same virus that we have on the cervix, the same virus that we have on the finger. So even inserting our fingers into ourselves, don't look what you're inserting. So we have to be very careful on what we insert into our body. So children also have it. Even talking about direct transmission, where we get it
Mm-hmm.
from direct transmission, mother to child transmission, which brings about a disease called respiratory papillomatosis. That kind of growth of what
So it happens in newborn, like it can
newborn.
get to the newborn as
The
well.
person
Yes,
breathes it.
yes.
Yes, the person
Through
breathes it,
birth.
and
If they
then
swallow the liquor.
yeah. So the person has
Wow.
that with the respiratory and can build up like those waxy lesions built up in the respiratory tract. And the person might have those cancer, waxy or low grade cancers in the throat. And the same cancers causes orophageal cancers. The high risk causes orophageal cancers. So either orogenital set, either you are leaving some from your mouth on the person's genital or you are taking it from the genital into your mouth. So HPV, as we are talking about, is very, very, very infectious virus, especially the what. The what my sister earlier said, and said that you can find it on your toes, every part of your body because it's very infectious. Anywhere the blister or the bump back, another, and then that fluid touches other part, brings about another one. So the HPV is
This
a
is
very infectious, very, very infectious infection that we need not to play with at all. And somebody
I
talked
think
about
at this
today.
point we'll be understanding why there's now the need for the national vaccination, because
Yes,
if it's not addressed, it will be at a point where even we have the youngsters experiencing it, because now we have the adolescents and teens, even people 9, 10 years starting to be sexually active, right?
yes.
So,
That is the
so I
reason
think
why the
I'm
vaccine.
really getting to understand why it has become a concern now. Wow. Wow.
And it's starting
Oh,
from that 9 and 14 before they even start their first sexual intercourse. Assume that at that 9 years they have not started any sexual intercourse yet.
hmm.
So they are bringing it in to vaccinate them. And the vaccine, as we go along, talk about the type of vaccines and what they contain and how it's taken as the time go along. Thank you. I think those are the only thing that we have high risk and the low risk. The high risk causes the cancer, the low risk causes the what? 90% sexually and non-sexually by 10%. And further. Thank you.
Thank you very much. Thank you very much. My next question is on the prevention and vaccination. Okay. Who should get the HPV vaccine? I think I've not heard Winnie talk today. I want to tickle her some more. Who should get the HPV vaccine, and how is it different from other sexually transmitted how is it beneficial for someone who is already like sexually active? Because just like Comfort said briefly, if they are giving it to our youngsters, probably is to prevent them from getting it when they start getting sexually active. But who should get this HPV vaccine? And is it still beneficial to somebody who is already sexually active?
Okay. For now, who should get the vaccine? I think for Ghana, our target is currently on our adolescent girls between the ages of 9 to 14 years. And we are doing this not to neglect our boys. They are still in the pipeline, but the first rollout is for our girls between the ages of 9 to 14 years. This is because we want to be proud to their start of sexual activity. And because of their age, they are able to build up stronger immune response, unlike the adult ones. And looking at their ages too, and then the cost involved in prevention, as the popular adage will catch them young and they'll forever be yours. When we get them early, we prevent them from getting to the worst stages where we have to do hysterectomy and the thermal coagulation and the others. So in terms of cost effectiveness, in terms of their immune response and preventing future diseases and complications, this is the target now. Primary target are for our young ones between the ages of 9 to 14 years. And research currently has been able to prove that when we're able to get these young ones and then vaccinate at least 80% of them now, we will in the long run reduce the risks also in our young boys, because this sexual activity is going to be done mostly by these young girls and boys. On the second question of does it still benefit someone who is still sexually active? Yes. After the ages of 9 to 14, the more years is also 15 to 21 and then 35 and above. So we can still have more vaccination for them. That is if the person thinks she's still at a high risk population. And the vaccination itself is preventing new infection, but not the existing one. So if the person thinks because of her lifestyle, she needs to prevent other reoccurring infections, then it is advisable the person goes in for the HPV vaccination to prevent new infections. But the other existing ones, the person will not take care of that one. And there's long-term benefit if the person is able to do it, because it can prevent the person from getting cancer if the person is already not exposed to it. And it provides us a herd immunity for our young girls in the neighborhood. So that's a little I have to add. Thank you.
Okay, all right. Thank you.
Quickly add something to Winnie.
Sure.
Yeah. So 15 years onwards, they will have to do the test first. You have to do the HPV test before they will give you the vaccination. Or as positive, you have to do your team for the system is depending on the stage, like Mr. Gifu was saying. They do the staging and treat you accordingly before if so anybody who is to go for the vaccine.
Oh, Sidonia, it seems your network is breaking up.
Yeah, I'm back.
Oh,
Hello?
okay.
Yeah, so I was just adding up to what Winnie said about the mop-up, where right now in Ghana, what we are saying is that, or I even think that research says that before you take the vaccine, they will have to test, you do the HPV test for them to confirm that you don't have before you will be vaccinated. Thank you.
Thank you. Comfort, would you want to add something to this one?
Yes, please. I want to talk about the who are
Yeah, how
eligible
beneficial is it for somebody who is already
sexually active. Okay. So it is beneficial to those who are sexually active only when they are screened. My sister talk about the mop up to some age, let's say 18 to 25. WHO put it up to 25. So it's a mop up stage for them, and then they will take, so they still benefit. But those who are sexually active, you will never know if the person is already having the virus. So if you are giving it
mm,
blindly, the person might be 50% protected or not protected at all. So those who are
wow.
already sexually active need to screen. Remind you, we cannot screen somebody from 15, 18. WHO recommendation says that HPV should not be done for people below 25 or 30 years because those are the times that they are in sexual active age. And since we say that
Okay.
most of the HPV are transient, you will find a lot of HPV infection in them. And because they have a good immune system, they will clear them. Most of the time, most of them will clear them. So if you do HPV for maybe somebody who is 18 or 19 years, you do HPV for the person. The person may be positive, but you will be creating unnecessary anxiety because at the mention of the virus that you have HPV virus, which causes cervical cancer, the anxiety will even kill the girl before even she tends to have cancer. So HPV is not recommended for people below um 25 years, even if the person is um sexually active. So the sexually active stage, those people who can benefit are the people who test negative for the virus. But same time, the person can be 19 years, but the person is not to do HPV before the person will be. Even though some people with 20 years have children and can do the screening, it is best to do either DNA and pap smear, which will check the cells or to see if there's any pre-malignant lesion. So the WHO guideline that we are all using, there's age differences in the type of tests that are supposed to do for them. So those who test negative for the virus are going to benefit when they take the vaccine as well. But we should be mindful of at which age we are testing that person and what anxiety we are bringing to the person. Thank you.
Thank you very much. Does anyone want to add something? If not, my next question goes to Gifty. Well, I wanted to know what are some of the common side effects of HPV vaccines and what are some of the long-term benefits as well. And then I would like Anne to also let us know since they have been taking it for a long time, like when you are young, you take it, have people reported with any side effects that she knows of in the States since they have already been experiencing that. So, Gifty.
Hello, Sada. Thank you very much. So with the vaccines, I've not experienced anyone telling me of having any side effects yet. But so far, I've given about 8 people the vaccine, but I've not experienced had anybody complaining of any side effect yet. I don't know whether with the US they have people complaining of any side effects.
Yeah. Sorry, Gifty, are you done? I was gonna come in and answer.
But please, I'm done. So I would
Okay.
love to hear from the diaspora.
Yes. So, common side effects is they're usually mild side effects. It would be, that pain at the injection site, redness or swelling. Maybe the person may have some dizziness or fainting, which fainting is a bit rare, but it's more common in adolescent age. And then some people complain of headache and nausea as well. Um, but they're having, in terms of severe adverse effects, it's very, very rare. And so since there hasn't been many, there's not really any consistent cases that has caused any like consistent safety concerns. But usually we always, I mean, I think this is everywhere, we always check if someone has a specific allergy right before we give anything. So for us, we just try to make sure they don't have any allergy to yeast, or any issue if they've had the vaccine, or like if they've had, let's say they're getting the second dose. So making sure that the first dose that they received, they didn't have any, adverse events or side effects. So that's my answer.
Okay. I don't know, Comfort. Have you guys had any reports like that? Angelina, Sidonia, has there been any incidents of people having some side effects from this vaccine?
No,
Mhm.
Is either a yes or no anyway?
not really, no, no. So we have never had
Okay.
anybody having any side effects from the drug. I have vaccinated, all my 3 girls are vaccinated, have 2 shots. Nobody has any, and all the people I vaccinated are completely. Nobody complained of anything. So I think
Wow.
it's individual. So maybe once in a while somebody may, apart from the pain at the site that we all know when you take vaccine, definitely the site will be painful. Nothing. I've never experienced any. Thank you.
Oh, okay. That sounds very good then. What are some of the long-term benefits of HPV? And then I don't know if there's been any long-term safety data for HPV vaccine, since some of you are already been doing it before it's now becoming a national something. Has there been, I mean, what are the data or what are the values out there to be able to convince people that yeah, we can have this vaccine and nothing is going to happen to us?
Yes.
Can I take that one, please?
Yes, please, you can.
Okay, so for the number of studies, we have a study that was done in Kenya. It's known as the Kenshi trial. It is also supporting the vaccination of Ghana's gather cells to be 98% effective. We also have another one known as the I trial, also done in India. We have the CV trial in Costa Rica. We have in Tanzania the Doris trial. And lastly, we have our almighty WHO's Global Advisory Committee also issuing another statement of data supporting the gather cell vaccination and then the Savares as well. So there's a few number of data to support the safety, the efficacy of HPV vaccination across countries, where Ghana is also impacting us. Its roadmap, God willing, next week. This is the little I can add for now.
Okay. Anyone? Vicky, do you have some data to share? Some long-term benefits, some proof of what has been happening so far? Or Gifty or Anne? or family midwife.
Okay.
Narita, please, Winnie has said everything that I'm aware of. Yeah.
Okay,
Okay.
all right. Then it seems it's such a good data we have out there. All right.
Okay.
My next question is
Narita,
on
please, can I?
screening. Okay,
Some
all
of
right.
Yes. Since we are now starting the vaccination and in Ghana, there are some data that researchers that have done. You know, vaccine trial has begun in Ghana. That was 2015 to 2018, and it was a 15-year study that was done in Sudoku and the two northern region. About 53,000 young girls have been vaccinated, and then they followed them up for about 15 years. And it was safe. Nothing has come up that is not
Wow.
effective. I think they used that as well. And then I think 2018 to 2024, Rich Hospital also conducted another research, and nobody complained about anything with Gardasil. Cape Coast Teaching Hospital also did one, and even last year, Agogo Presby Hospital used Circulin. They use Circulin to also do a vaccine trial. So there have been a lot of vaccine trial in the country that they have followed up for a number of years, about 15 years, and it was effective. That is why I think after the trial, they have now seen that yes, the trial has been in this way. So now public can say that it's effective with everything. Thank you.
Can I
Then that
add
is a good
something?
thing, actually. Yes, please, and you can.
Yeah, so for the states, we commonly we're controlled by the Center of Disease Prevention. Um, that's CDC. So I had to look up some stats because I don't know it off the top of my head. But from what I'm seeing, it says that more than 98% of vaccine recipients develop an antibody response to the HPV types included in the vaccine 1 month after completing a full series. Um, they said among 14 to 19-year-old females, infections of HPV types covered by earlier vaccines has dropped 88%. And this is recent studies that just came out last year. Another study that just came out last year said that among women aged 20 to 24, vaccine type HPV infections has dropped by 81%. And let me
That
see,
is great.
yes, um, between 2006 to 2014, among females that are privately insured that has gotten the vaccine, the prevalence of anal genital warts has decreased by 61%. And between ages 15 to 19, and 44% has decreased as well in ages 20 to 24. Um, and then males also have seen a decline after 2009, because before it was women that were, female children that were getting the vaccine mostly, and then they started giving the males, and they have seen a decline as well. Um, Let me see. Cervical lesions by HPV types have dropped by 40% in women who are vaccinated as well. And the rates of precancerous lesions among women ages 20 to 24% has dropped about 80%. So that's a summary. There's a lot of more statistics, but I just wanted to give the most important ones. Yeah.
Okay, thank you so much. Thank you. I want us to talk about screening. Now, I know that all these probably the people that we are gonna encounter are not gonna say they are sexually active or something, but I want to ask about screening. Why is it that even after someone gets the vaccine, the person is still encouraged to be doing pap test? I want to find out why. I thought maybe after vaccination, shouldn't it be done? So Comfort, Gifty, Sidonia, Vicky, why? Why are they asking them to come again?
Okay. So let me take it and then the others, my senior specialist will come on. So you know that the HPV virus comes with different strains. And currently, what we are giving is for 4 different strains. I think that's for the 6, 11, 16, and 18. But we have other high risks as I think Comfort or someone was mentioning. We have the low risks and the high risks strains. We have other high risk strains that are not being covered. So if you think that you have been vaccinated and you still don't protect yourself, you can still go and then get infected by any of the other high risk strains, and then you will still develop the cancers that we are trying to prevent. So that is why they are saying that even if you are vaccinated, you should still try as much as you can to protect yourself. So that is why they are saying that even if you are vaccinated, you should still try as much as come on board.
Oh, Sido, are we losing you?
I think Sidonia has just taken what is in my mouth. Exactly what is on my mind. Sidonia has just spoken for me. So yes, we have several strands of the viruses, and each of them also have the potential of causing the cancers. But usually,
Mm.
the vaccines that we give are for the low risk, which is the 11, and then the I think 6 and 8 or so, and then and the 11, and then the 16, and then the 18, which is also high risk, and which is the commonest one that causes the cervical cancer per data, right? So that is what the vaccine that we know, and that is the vaccine that we give. The other vaccines are there, but I think the prices, the other time I asked of those prices, they were that huge. And I think they're also not too common in our setting. So it's just the 16, 18, and those ones that are common, that wherever you go, you can get it. So we need to be testing, even though we are vaccinated, we still have to test, so that in case there are any pre-cancer lesions or anything, we can just pick it fast. Because if you wait for the signs, for any sign at all to come before you go, and by that time it had already probably gone a little far. That one, it really depends on the time that you also decide to go. So the testing
Mm.
is very. I think we have to test up to 60 years or so, 65 years. Please, somebody correct me before, if nothing or whatever it is we treat, then we stop the testing.
And then
Thank
how
you.
often am I supposed to test? For example, if I should test this year, when should I do
So
my
what
next test
yes, so what I
again?
know is that when you do the test and you are negative, let's say when you do the pap smear, the liquid cytology and all that, you are negative, they will say come and test again in, let's say, 5 years. Some people will say 3 years. When you are positive, let's say when you are positive for the virus, but not any malignant cells, no cancer, nothing, that one they will say the following year. So that one, the test becomes yearly until probably you are negative for the virus. But then when you are negative for the virus, they will say come the next 3 years or the next 5 years to come and test for the
Okay.
pap smear, whatever it is that you want to do. Yeah. Thank you.
Okay. So all right. Comfort. Winnie, does anyone want to add
So
something
to
to
add
that?
to that, um,
Okay.
so to add of the HPV virus, then we have 15 of them that causes that can cause cervical cancer, and we have about 7 or 8 of them that causes the what. And among the 15 of them that can cause cervical cancer, the type 16 and 18 causes about 70% of also causes the what. So here is the case. Ghana is vaccinating our girls against only the high risk, the 16 and 18. Then also the low risk, which is the 6 and 11. So that means there are others they that can. So that is the reason we need the training. What I also know is that, when you do the HPV DNA testing, depending on your age and depending on your immune system, if you are an HIV patient, you do HPV, I think, every 2 years or 3 years. Then also, if you are a normal person, you do it every 5 years.
Oh, it seems we are losing
So
Gifty.
I think
Okay.
after 4 consecutive time, if you don't test positive for VIA or pre-cancer lesion, then it depends on the number of times the person has also done the test. Then when it comes to the pap smear, if the person is above age 40 and starts their pap smear, it depends on the number of times that the patient becomes negative. You do it after every 3 or 5 years. And VIA, you do it after every 3 years. Then if you are HIV positive, you do it every 2 years. So it depends on the person that you are also screening, whether a normal person or an immune suppressed individual.
Okay. Okay.
Thank you.
So I think the disparity in the person's health status would also, determine. I just want to find out. So in case somebody has diabetes, hypertension, autoimmune or something, would you categorize them like as part of, let's say, those who have the immuno suppressive conditions, or they will be like the other
Yes,
ones?
please. They are all immune suppressed people. Please.
Okay.
They
Okay.
are all immune suppressed people.
Okay.
So any virus
Okay.
that or any bacteria that gets into them, you know that their immune system cannot fight it. So that is why we say
Mm.
immune suppressed individual. Example: HIV patients, diabetic patients, cancer patients, and all that. Thank you.
Thank you very much. Does anyone want to add something to it so we can move on? If not,
Yeah, yeah.
okay.
So one needs to continue to be vaccinated. As was said earlier on that the vaccines that we are taking does not have contain all the strands of the high risk and the low risk. And apart from that, we know that 70 and 90
99.7% of all the cancers are caused by HPV related. And then we have some 0.3 thousand that are not HPV related. So, because I've seen
Okay.
somebody with a particular nation who it's not HPV, because while we are even doing survey or research on cancer patients, and we want to know the type of virus, the strand that is causing their cancer. And there are some that HPV is negative, and if you do
Mm.
again, it's negative. And so it means that the cancer the person is having is not HPV related as we are talking. So HPV is not, is 99.7% related to a cancer. But there are some other cancers that are not HPV related. So it is good that even when the person screen, the person get vaccinated, the person should also screen as well. And in addition to that, there is some corrective misconception or something going round, and as we are all here, I want us to think. People do pap smear. When talking about cervical cancer screening, people talk about pap smear, pap smear, pap smear. So majority of the population know that pap smear is what is used to do HPV, to do the cervical cancer screening. I want to clarify that we don't do pap smear to take HPV vaccine, because HPV
Okay.
is a virus. If you do a pap smear is just checking on the cells of the cervix to know if the cells of the cervix are normal or abnormal. If they are
Okay.
abnormal, it's 2%. But it will never tell you that you have the virus, because you might do pap smear. Pap smear is negative, I think thousands. Pap smears are negative, but the person is having the virus. And then we do colposcopy or VGI, there's no lesion on the cervix, but the person is carrying the virus. So if you vaccinate that person, the person is not protected. So we don't do
I
pap smear to take HPV vaccine. We do only HPV to take HPV vaccine. Pap smear is specific to tell you that you have cancer, that you have abnormal cells, but HPV is sensitive to tell you you have the virus. So we don't do pap smear, we don't do GI, we don't do colposcopy to take HPV vaccine. Only
so
HPV screening.
Comfort, what text exactly is done before you can take the vaccine if you are sexually active?
HPV.
Come
HPV
again.
DNA test. HPV
Okay, so you need to
DNA.
do the DNA test to be
Yes,
sure that you don't have the virus in you before you can
before
take the vaccine.
because if you like yellow fever or how do I say it? You are taking a vaccine, then you go and then you check, or you don't check, and you have the virus in you, and then you take the vaccine. You are not protected. It's not doing anything to you. So the
Okay.
same way. So you check and you know you are negative. Then you go for the virus, then you know you are fully protected. Because you might
Wow.
take the injection and you think that you are protected, or you know you have the virus, and then you say, but I've taken the injection, and I've got pap smear too, pap smear too, it's also negative. Pap smear is not telling you that you have the virus or not.
Okay.
It's
Wow.
only DNA test that you do and know your
Mm.
status, and then you do. So, and then depending on your results from the DNA, that will determine how long you should come. Because if you are total negative, it means 5 years before you screen again. And if you are positive, meaning between 6 months and 1 year, you should check again whether it has clear or it's still persistent.
Okay.
Yes.
Okay. I want to find out. I think when everyone was speaking earlier, we made mention that the HPV virus can clear on their own. With some people it will clear on its own because the body can be able to fight the virus if it's very mild or maybe very scanty. Are there incidents where people are not able to fight the virus on their own and it becomes like persistent infection that somebody reports with in the hospital before we get to even get, I mean, talk about those who come with cancer? On the normal viral infection, do we have people clearing it or getting cured, or Some people will be under treatment and be coming every time. Those in the clinical settings. I want to
Thank
find
you.
out.
Let me continue. Thank you very
Okay.
much. You see, we're talking about the carrying of the virus and then its persistency. We are saying the persistency of it that leads to cervical cancer. You
Okay.
don't just get the virus once and then you are having cervical cancer. No. That's why when Gipsy came in, she said that before you get a cancer, between 10 to 15 years or even more than that before to manifest of you having a cervical cancer. In our setting, we did about on persistency of HPV. I have had people who we followed up for 5, 6 years who are HPV positive, is persistent. About 2 or 3 years, it was the same virus that was persisting, and then other years they changed, meaning they have collected those virus and another one has come for 5 years. And pap smear negative throughout the 5, 6 years. Proctoscopy was normal, there was no lesion, no malignant lesion on the cervix. So people can have a persistency of the virus, but the virus might not, because they have a good immune system, though it has not cleared, it is still there, but has not changed the cells of the cervix for the person to have cancer. So yes, people will have naturally and are not able to clear the virus. And people
Can I
also play by 6 months, people can also play.
Okay. All right.
can I add something?
Yeah.
Yes, please.
Okay.
Um, besides the usual immunocompromised individuals that have tested positive for HIV, cancer, and people on long-term high-dose steroids, chemo, and different things, women of older age. So usually persistent HIV, I say HIV, persistent HPV is more common in women over the age of 30. Usually when it clears in an earlier, usually the HPV that clears in the earlier ages, usually for people who are in a younger age. So when HPV remains in someone who is over the age of 30, it's usually like a red flag. So like if they are, it shows that they are higher risk of cancer. So that's when, the provider may start doing investigation like, okay, in your family, do you have people who have had history of cervical cancer or cancer period? Um, there are people who they get reinfected or multiple recurrent HPV infections by getting like another type. Maybe people who are, um, I don't want to say this word, but have multiple sexual partners, like partners that are considered high risk partners. So, people who, don't use protection and those type of things. Um, and then there's also like lifestyle factors. So people who smoke a lot, people who smoke, it can, reduce their immune response and their cervix. People who have poor nutrition. So, that's why, especially for women, Black women, they always push them to be on it with their vitamins, their folates and vitamin A and C and all those things. And then people who are always having, chronic, suffering from chronic stress. So people who are always stressed or who are not sleeping well. So those are the things that I would say, those are the categories of people that usually suffer from recurrent HPV infections.
Okay. All right.
Can
Thank
I
you so much, Anne.
hello, sir. Yeah.
Yeah.
So I don't know
Yeah.
whether it's a question or whatever, but let me say this. What if someone comes to you and let's say the person have done the HPV, but then it's the commonest type, which is the 16 and 18. The person is negative, but probably is positive for other strand. So are you, or do we have to, and the person asks you, I want to take the vaccine since the 16 and 18 is negative, and that is even the most commonest. What would be our response? Would we give the vaccine? And again, in addition to that, I learned or I read that the cervical cancer is not oncogenetic. That means hardly will it run through the family. It is that you acquire like through sexual intercourse and other means that we have mentioned. But we are still learning. I just also learned today that someone said she encountered someone who have the cancer cells in the cervix but tested negative for the HPV. So I'm beginning
I mean,
to,
this is so, I mean, like new findings, huh?
yeah, because I know it is not genetic. So when somebody is having CA7, you don't even ask about. Fine, you can ask, but that doesn't contribute to the fact that a history for you to pick out that okay, the person doesn't have history of cancer. So why is she having it? Because it's not in the family. Yeah.
Well, can I
So
say
the
something
question I
about
said
that?
about the vaccination, yes, if someone can also, I have my answer. Maybe I will give. I will let the
So
person take the vaccine, but I don't know what
okay.
other people will say.
So in terms of the cancer, like we know cervical cancer is not necessarily genetic like breast cancer. But if a person has, if cancer runs in the family in general, so something like breast cancer, that predisposes the person for any type of cancer, like period. So if like someone who their mom, grandma, aunties, great grandmother had breast cancer, it's they're in high risk of cancer in general. So it
Mm.
is still very important to ask because okay, they still have had, some form of cancer, and we all know that someone can get breast cancer, they can go into remission, and then years later they can get kidney cancer. Like because in general, the cancer strain is already in the body. So that's what I want to address when it comes to that.
Okay, Winnie, Angelina, Comfort, Gifty, Sidonia, any answers to Victoria's question?
Yes.
Okay,
So
thank you. So
the
for me, depending on the type of vaccine the person is going to take, is if it's the Gardasil 9, I will still encourage her to take because it's going to cover her for the other strands. Remember we have 15 strands that causes cervical cancer, and the person is positive for 16 and 18. So that means the others, the 33, the 31, and the
No,
others,
the person
it's
is
going to
negative.
protect her. So for me,
The person is negative for the
negative.
commonest type, which is the 16 and 18, that causes the cancer. And the person is insisting.
eh,
It's a scenario I'm trying to put up. Insisting that okay, if it is and
oh,
I'm
okay.
negative to it, I want to take the vaccine so that at least it will cover me for those 16 and 18 and maybe even the minor ones. So will you give?
Oh, yeah, you can take it. Yes, you can still take it. The person can still take it. Once you are negative, you can take it.
Okay,
Yeah,
thank you.
and
Thank you.
I think Vic already answered herself. So she's negative to the 16 and 18, which basically is the high risk. And now we are saying that they cause about 70% of these cervical cancers. That means the remaining 30% of these cancers, the person is prone to it. So, yeah,
Mm.
I think it's prudent if you give it. I beg to differ more, but me, I would definitely give it because we are saying the vaccine should protect them from other form of cancers, and we know the 16 and 18.
Exactly.
So why won't I give them? I will. So
Mm.
Vic, you
Oh,
will. I will also.
I think majority of us will, we'll look at the brighter side of giving the person, maximum protection than to leave them at risk, isn't it? So I think the benefits will
Yes,
outweigh
please.
the exactly. Okay, let's come to
Then I
mental
want to,
health and stigma. Okay. Did I hear somebody?
yes. When
Okay.
it comes to yes, um, like she answered herself already. But what I want to ask you is to consider the type of the vaccines that are available. If the person is negative for the 15
Okay.
and 18 and negative for other high risk, that is when a full genotype is done. Then you know that the person is negative for all other
Mm,
people. And it's only several speculate that we have, yes, since the person is negative and those vaccines contain that, yeah, the person is eligible to take it. But should, if let's say you are having that at a 9 and the person did um, full genotyping and then there are other strands also in it, then the person cannot take the Gadata 9, but the person can take a Gadata 4. The person can take and can take Seculin, can take Sevarix, but the Gadata 9, unless the person does a full genotyping of the 15 high risk band. Because if you're taking the Gadata 9 and you do partial genotyping, you might be positive for any of the other high risks, which you are also taking the virus on while you have it already. So it's a way that when the person can have to triage and see, is it full genotyping? Is it because of the 16 and 18, that's why you want to take it? Or you think that you have full genotyping, you have other strands, but still want to take it as a nice. So you should consider the type of the vaccine that we have whilst we give the vaccination as well.
okay. All right. Thank you. There's been a lot of stigma when it comes to HPV, especially, with our culture and everything, when people think that, oh, something is related to sexual stuff or infidelity. So even just somebody reporting with just that one make them feel a bit off and some even related to spirituality. Okay. This goes to Winifred. How can people cope with the psychological impact of an HPV diagnosis, and what advice do we have for discussing it with their partner? How should we go about this?
Okay. It is true that mostly when we finally give the results out to people, it can trigger some form of anxiety, shame, and then fear. But I think what I use in my facility that is working out for me is to be able to normalize the diagnosis when you are telling the person. Now, at least now HPV is common, just like we've all mentioned since morning. And nearly everyone in one way or the other come at a point in her life to get into contact with it. But with good immunity, the person is able to overcome it. Then the person can also read or seek for other information from reliable sources or join webinars and seminars like we are doing to create more awareness. And then avoid the self-blame. Having the HPV virus doesn't simply mean that you engage in a promiscuous life or you have multiple sexual partners. But just like there are other forms of sexual contact that you can get it, the person could have also gotten it from that source. So it doesn't become so alarming for the person, it reduces the anxiety. The person can also build some form of network of support around her or her neighborhood. Talk to people she can trust and can also practice some mindfulness and journaling so that she write down things that make her happy, that makes her inspired, and then also encourage herself. Then on your second question with discussing with the partner, I think it is worthy if the person can openly share the information with the partner in an open, respectful way that builds trust. So she can do that by looking at the right moment for her to discuss the information with the partner, and choosing the right moments, a private and a calm place, being honest and clear, and also invite questions from the partner so that they can all deliberate over it. If there's facilities that are facilitating women health to also get more information. So that's a little I can add in response to that question. Thank you.
Thank you. Thank you very much. Family midwife, this question also goes to you. How can people cope with the psychological impact of HPV diagnosis, and what advice do you have for discussing it with their partners? How do you do it at your end?
Hey, Director, we all know that if we put ourselves in the client's shoes, even when you're diagnosed with malaria, sometimes you keep asking yourself questions like, but how did I even get this malaria? I've been sleeping in mosquito net, oh, I've been inside, I've been using all those things. So at that instant, when you break the findings or the news to the client, you would have to understand and allow the person to express his her grief and try and understand them to their level. This will be done through the counseling that you did before you went ahead to do the screening for her. And so at my end, before you come for the screening, I take you through the counseling properly, let you understand the reason why we need to do this, the benefits, and then the results. If it's positive, what you expected to do, if it is negative to what you expected to do. Based on the results that is given, if it's positive, then we go ahead to let you understand what is really going on, allow you to ask questions, and then we proceed with the support. You involve the family and then the partners should a need be, and allow the clients to tell you what she wants to do. And that is the only way you would understand the client very well and then more. Also, everybody grieves differently, and psychology sometimes it's not easy for someone to um uh just adhere to whatever instructions or the treatment you have offered at that moment. And so basically there's something like support, just like Sister Winnie said. You let them know it's not everyone. There are people there that you've screened also as well, and what they've gone through and everything. Now you let them understand the processes. And I think this is what works best for me here at my end. We also do follow-ups as well. Sometimes you go to them, let them know how they are faring. If you have any questions, they call back and then we take it from there. So I think these are what I do here and it has been helping. I hope to learn more from my other colleagues here so that I can also incorporate what works best for them there. And then together we can at least help with the client's psychological state. Thank you.
Thank you very much, family midwife. Gifty. Gifty, how do you go about this? Like, how can people cope with the psychological impacts on HPV diagnosis, and what advice do you usually give when you're discussing it with a partner? Oh, immediately I said Gifty, I lost Gifty. Comfort. Comfort, please come in for me. How do you do it at your end?
Thank you very much. With the diagnosis as a stigma, you have to do a very good education. Even talk about the outcome of the test, whether it's going to be negative or positive. Talk about it and the way forward. Should it be negative or should it be positive? You talk about it. So most of the time, because of the in-depth education that happens, many people don't think as who knows that their partners are, like say, politics, because my husband has been flirting around. Recently, I tried some bumps on the penis or something. But those who don't come because of those information, you do a very good education. You do a very good before the results come. You tell them the outcome. You should be expecting it this way. So many people just have a little thing. How does it come? But during the education, when you have it, they don't even ask that. They say, "Oh, you told me already." And so it's not even a stigma, I may say, just the fear. Doesn't mean I'm going to develop a cancer. That is the fear that people exhibit. But the stigma doesn't come already, but the anxiety and the fear that doesn't mean that if I'm not able to clear it, I may be having cancer or I will have cancer. That is where the education also have to kind that when you have the virus doesn't mean you have cancer. And then discussing with the partner, I have done a lot of that. Desire that to tell the partner, then you call the two, and then you counsel them about what the HPV is. Not that she alone is having it, but it might come from anybody, can come from anywhere, like when we're talking about the transmission. So the partner comes down, and now the way forward, how do we clear it? Because it's sexually transmitted, to put the two at the safer side. I always counsel them that for her to clear the virus, we need to prevent reinfection. So protective steps have to be adopted. That is, if they are not even it's not infertility, which means that they should use a barrier method condom. They both have to boost their immune system, and they use a barrier method at least for 6 months. Then the woman comes back, because if you are having unprotected sex and the woman is having it, you get it onto your penis, and then the next time the woman wants to clear, you have washed it in there again. So the only thing that will protect both of you is that you use the barrier method, and the woman tries to clear it, then you also come in. Maybe he might also be having it, but because we cannot test you. So to prevent both of you, let the woman have what is having, let you also have what also you have, as you are not washing it or taking in more. So I counsel them this way that they try to do. And then sometimes 3 months people say I want to do it every 3 months. And sometimes it's correct. Most of the time it's correct when they use to. Thank
Hello, Sada.
Yeah, Gifty, you're back.
Sorry, yes, my line dropped.
Okay, no
Um,
problem.
so to add to what Auntie Comfort has said, about 4 or 5 days ago, I was a lady, or when did we post the flyer? Was it 3 days today
Yeah,
that
I
we
think
started?
so.
Yeah. So the person saw it on my status and WhatsApp me, how I knew about this vaccination. So I said, before this problem. So I asked her why. And she said during the screening, she was positive of 6 of the high risks. And so she
Wow.
was given, yes. So I asked of her age, and she was 28 years. So she said she was given an ablative treatment, and I think it was done because last year during the IPVS conference, they mentioned that if a patient is positive of the high risks, you can now do ablative treatment for them. So, and that's why I think they did it. And so
Hmm.
now she was now asking, she doesn't even know how she had it, whether from the
Oh,
husband. So, so I said, and it's dicey because um, she should permit me to ask, was she a virgin before meeting the husband? And she said no. So I now took her through the number of years that the virus come and stay in a person.
Mm-hmm.
So she then said that she now understand. And so now she's blaming herself, blaming the husband. But after she has had the education, she's now relaxed and known that, oh, it could be from my previous sexual act, not necessarily from my
Exactly.
husband.
Exactly.
So now she's calm with that aspect. So I then told her that now the only thing that we can do is for her to make sure she goes for the regular screening so that anytime it surfaces, then we can know what to do on time. Uh-huh. Because we are still having sex and men cannot test whether they are positive or negative. And so probably, and also I gave her some of the things she can do to boost her immunity, exercises, eating well, drinking a lot of water, um,
Mm.
um, uh, personal hygiene and all that to help her so that the reinfection, like at least the immune system will be able to clear most of them off for her. And so it's really challenging. People really go through a lot. So some of these advices we can be giving them and guiding them and letting them know that it's not a definite thing, that definitely once they've gotten the virus, they are getting cervical cancer. Their immune system can clear it, and maybe teach them what they can do to also boost their immunity, which will also help. Thank you.
Thank you very much. Thank you so much, Gifty. I mean, I believe that is what to do so that people don't feel that, oh, because I'm not cheating on my partner and I've been with you and I'm faithful. Now I have this and I'm thinking it's from my husband. So at least for them to have that
Yeah,
understanding that it can live with you for a very long time. So don't think you're just having it now because you're a faithful wife. You could have brought it from
yeah,
your previous year. And then I love the whole idea of letting them understand what they need to do now. Now you have it, okay? You need to fight it, and it's a virus. And one thing is that viruses find suitable places in the body and then they survive. So if you're able to work on your immunity, no matter the virus, and no matter the virus and what they do, if you work on your immunity and you adhere to the preventive stuff, you're definitely going to live longer than you think, right? Okay.
sure.
I will
And
let.
I
Okay,
wanted
does
to
someone want to?
I wanted to ask something.
Okay.
So um so I'm thinking back about of when I had to get the vaccine, and
Okay.
we all know we all know African parents, right? When anything about, oh, this vaccine, I don't know how it is in Ghana, but I know here when African parents get presented with this, oh, we should vaccine your daughter or your son because of, potential this, because, they are that age, blah, blah, blah. And they don't want to hear even about that because they don't even want to even, every African parent envisions their child being a virgin until they get married. And so
Exactly.
they feel they feel as though you even giving them that vaccine is given, in a way, giving the child to go ahead to go and, you know engage
I
in.
think it's very typical of African parents. Even to
Exactly.
talk about sex education,
Exactly.
they
It's
feel
a
immediately you start talking about it, meaning you're encouraging your
You're
child to,
encouraging them to have
yeah.
sex. So for me, when I went to go and when I got the vaccine, of course, because I was 12, my mom was there, and the doctor had to ask my mom's consent. And initially my mom, was very like, what is this for? And then my doctor said, oh, because she's at that age, my mom said, at that age for what? and and she said, oh, I mean, luckily my doctor, my family doctor was an Indian lady, so she understood culture, and for them it's pretty
Yeah,
similar as
because I
well.
think they're also as typical as us when it comes to
Exactly.
those things.
So she educated my mom and said, listen, I know that how our cultures are is similar. That kids, they're not supposed to have sex until they marry, but we live in America. We know that
Yeah.
kids are not, they are testing themselves. And now in Ghana, we know that in Ghana we are seeing, I mean, teen pregnancy has been there from our grandmother's age. But
Yeah.
now
And
the
now they
rate,
are even going below the teens.
exactly. So we know that that age they're very curious and those things. So I want to find out from my my esteemed colleagues here who has been given the vaccination. How have you guys ran into any hindrance from parents? How have you guys been able to educate? Because I think that's also very important since we are trying to push this vaccine at that age, because we know the effectiveness is better at that age. I think it's very important to know how to properly educate the parents so that they know, say, okay, me giving this vaccine, it's not me saying that your child is a bad boy or bad girl. I mean, a bad girl. So it's because of X, Y, and Z. So I just wanted to shed light on that topic because I think it's very important. Yeah.
Comfort, Gifty, Sidonia, Winnie. I think Winnie is not here. Vicky, family midwife. How has the experience been? How
Comfort is
how
here.
many how many youngsters have you been able to vaccinated where their parents have some in?
So
Okay,
what we
comfort.
usually do is the sensitization before any other thing. So we from our side, we started with the health volunteers and the community health committee. They are within the community, they stay with them. So first of all, we engage them and let them understand what the vaccine is all about and what they stand to benefit. And if they don't also allow their kids to take it, what they will be losing, the risks involved in terms of the hesitancy to prevent it. So from there, we now do the whole community there. Then we engage them in the churches, and then we go to the schools itself to meet the children themselves, the peoples, and explain to them. So with that, is that we will hardly find refusing, but most of the time they come around. It's usually the myths. But once we are able to get them to understand through these community structures, we usually we do not have a lot of problems like that. Thank you.
Sorry, my mic was off. Who
Hmm.
wants to come in? Comfort, do you want to say something about that?
Yes. I think introducing the vaccine, I don't think, though people may have other perceptions about having the vaccine, I don't think it's going to be there will be any hindrance, much hindrance if education is done well. Because many people are hearing of, especially the cancer. So if the education is done well and the parents understand that you don't want your child to have this cancer in future and all that, the signs and symptoms, people will say, okay, I had a family friend, I have a family member who suffered this, but we didn't know what was happening. Oh, so let my child come. Because many people come to do HPV testing, and when you explain very well to them, By the time you realize they are bringing their children for vaccination, even though they are paying. So I've seen a
Wow.
lot of people who bring their children for vaccination because they have heard. If people bring their wife to come and take HPV screening or several cancer screening, by the time you realize the man alone comes with two children are coming to vaccinate both boys and girls. So you have seen a lot. So if education is done well, people will be willing to come themselves to have the vaccine. And because at 2023, I think Stanford, what facility conducted that in the Katamasu district. They wanted to um, vaccinate about 1 million. The turnout was not optimal, but a lot of people came and they came. It wasn't a weekday, Wednesday, and many people came with their children. In the school, the people who are even in the school, their parents come in case of any, so that in case of any side effect, they might help. And people came out. So I think if the education is done well, people will come for the vaccination. The little inside.
Wow. Wow. That's really, really some good news there. So at least we are happy to find out that people are learning and parents are becoming open to these things. And I'm sure the way we live in, this kind of commune society, when one person does it and the other gets to know, it will encourage them. That's how Ghanaians are literally, unless they've seen family members or friends who have said, oh, this thing is good. It's better you let your child, go into it. And then they will become comfortable. But I'm happy about this whole mass vaccination that is going on. Since you ladies are there and are in connection with it, since the government is making it like a national something, how is it going to be? For example, now that we have these children, already being sexually active and already exploring themselves, are we going to be asking them, are you sexually active before giving them the vaccine? Or we just want to assume all these children are not sexually active, so we'll give it to them. So this goes to Comfort, Family Midwife, Gifty. I mean, you guys are the ones going to take this action in your various facilities and districts. Is there like a protocol where they want us to be finding out from them whether they're sexually active before, or it's just like mass vaccination, so we are just giving the vaccines?
Hello?
Yeah, Mousy.
Yes,
Comfort.
yes. So far, I've read a lot, see a lot of memos and things going around, but I have not seen any protocol to ask a child whether you have had sexual intercourse before. So I think this one is
Mm,
the mass vaccination that is going on. I think
okay.
between 9 and 14 years. That is what is given, but that is what we are giving, fine. But should the person be outside that, then you have to ask. Because I ask a lot of people who are 17, 18, who come to the facility, they want the vaccination. I ask them, is the person sexually oriented? I always ask them. If they say yes, I say, okay, if I give to you, you might be half protected or fully protected. Do you want it? Mommy, do you want it? Because it's expensive. Because I feel about 1,005, Mona sell about 3,000 plus. Do you want to go ahead? Say yes. If you have had to take the head protection, I want, whether sexually active or not. So after this vaccination, after this mass vaccination, that is when those questions, the protocol supposed to come, depending on what you find on the field. So I think those who are here are on the field. I think we should put this into a policy making order in a way that those who are 10 years above or even 9, we should ask them whether they have, because they're already teaching them sexual education at school. So we should ask them,
Yeah.
has any man put something into you before? If they say yes or no, or I especially ask you yes or no, this is going
Yeah,
to make
because
a conversation.
since I mean it can be on somebody's finger, and if
Yes,
it's on somebody's finger and he insert it into you, though it is not like coitus per itself, but the
yeah,
person
no,
can
it's not
still
for the
infect you.
even rubbing. When I say when you are rubbing, you might have it like brushing or whatever they call brushing. Somebody can say this practice there. Anytime I do education, I talk about brushing. People have, yeah, people can brush, not penetration, but can leave something there. So I think when we ask this question, it will bring another way that a protocol will be drawn to know who and who is not to get it. I think it will bring another um, 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 information and insight of sexual and reproductive health things in adolescents or teenagers. Thank you very much for your question.
Okay. Thank you
Yes,
so much. You guys have really made, I mean, our day. We still have our viewers on our live stream. I can see Eunice, I can see Anne Frempong, I see Joanne, I can see I saw Mr. something and Mr. um um oh okay. Okay, Mr. Jima Sabina is here. Um Mr. Farrell. Okay, and then Ajoalabi, I can see her too. All right. So our next question, I mean, it comes to the guidelines. That what are the latest guidelines? That's how come I was asking of, I mean, before testing, what are some of the what are the latest guidelines that we have now when it comes to co-testing and screening, particularly depending on the age of the person. Let's say whether they are age ranges. What do we do when it comes to the testing? It's Gifty here. Yeah, I think I'll start taking it from Gifty, and then yeah, we can move maybe Vicky too, in case you know the latest guidelines at UGMC, you could share with us, and then Sidonia and Comfort too can share. And to in case you know the latest guideline in the state, you can share with us. Let's see the disparities and yeah. Oh, I have a question here. Oh, yeah, it is free. This one I'll answer it. So please, Gifty, you can start. Oh, did we lose Gifty again?
yes, it's lost.
Okay, then Comfort. Maybe you could start and then yeah, before Comfort comes in, I want to find out the age limit is 9 to 14, right?
Yes.
Okay. Yeah, so you can go ahead. Go
Okay.
ahead. What are
Thank
the
you.
current guidelines you're using in your facility when it comes to testing and co-testing,
So,
depending on the person's age?
okay. So that a guideline. We're talking about other vaccination guidelines. You want
And the
that?
screening guidelines. You know, for example,
Oh,
those
okay.
like those the
Okay.
elderly.
Okay. So, earlier on, I spoke about for vaccination. The same way there's a guideline also for cervical cancer elimination, the 2021. So as I said earlier on that HPV DNA testing should not be done for people first they even 30 years. but some countries use 25. So below 25 years, HPV testing is not done because they are in their sexual active age, and then many of them will be will test positive. So, putting everything together as a trainer, what we do is from 21 years of age, that is when screening starts. So, those who are 21 years to 24 can use pap smear because the pap smear is specific and tell you if your cells are normal. So we use pap smear for them and VIA, visual inspection with acetic acid or colposcopy for them. And from 25 years and above, they can start using the HPV. So somebody at 21 years can use the co-testing of pap smear and visual inspection method. So what the pap smear will test if the cells are normal, and two, to see if the visual inspection to see if there's any pre-malignant lesion already. Because we have treated people who are CIN to cervical intrathecal neoplasia 2 who are 22 years, and it's only VIA that we used to take, and then we took a biopsy and CIN 2. So VIA and pap smear is at that age. VIA, because I mentioned earlier on that some people who have negative HPV have a pre-malignant lesion on the cervix. So you see, if you do visual inspection method for them and pap smear at a co-testing, you are sure of the cell, and then you are sure of a no pre-malignant lesion. Then going with those who are testing with HPV and pap smear from 25 years and above, they can do co-testing of HPV and pap smear. Then you are checking on the cells and at the same time checking on the HPV. So you are using specific or specific test and a sensitive test. But as training, we always tell everybody visual inspection is very important. So if you think you are doing a sensitive test and you are doing a specific test, may come out as false negative because every laboratory test can be false negative or false positive. So the visual inspection might denote or show any signs of pre-malignant lesion. So it is
Comfort, do you have some visuals that you can share? Are you using your computer or something? I could.
Yeah, I'm using my computer.
Yeah, so let me stop sharing the flyer. If you could share your screen to show that.
Shows the visual. Get an atlas.
Let me stop sharing my screen. Yeah, because I'm sure that some people would want to see, viewers' discretion, but would want some people to have a look at how, when visual inspection is done, how a normal cervix looks from the other one.
Oh, I lost you. I didn't hear you.
Oh, okay. I meant that would one other our viewers or anybody who comes to watch it later to see how a normal cervix actually looks from the one that is having some lesions or the abnormal cervix when the VIA is done.
Yes, I have atlas. That's made from my side, like shoes.
Okay. So as Comfort is getting ready,
are you seeing me? My video is full.
your video is still off, and You're not sharing your screen to.
Yeah.
Okay, so as Comfort is getting ready, I don't know if Gifty is back. I know that Gifty too does screening. Yeah, so Gifty, as Comfort is getting ready to share some pictures or yeah, pictures with us. Would you mind letting us know what are the latest guidelines when it comes to testing and co-testing and screening when it comes to the different ages of our population, the younger ones, the 20s, the 60s, I mean the older, the young, the middle. What are the guidelines? Gifty, can you hear me?
Hello, Sada.
Yeah.
Please, you were asking about the screening guidelines.
Yes, that's you using at your end.
Okay. So at my end, we also use the WHO guidelines, but then there are times which say that you should start screening at 8:30 VIA, but then we use our own discretion and we screen as based on the person's history from age 25 going. But then I think last 2 years, January Awareness Creation Month, there was a free screening and we had 18-year-old testing positive.
Wow.
Yeah, so even though the screening guidelines are there, sometimes we use our discretion based on the patient's history that we will take. And also we do a pap smear for people above age 40 and also the
Mm.
HPV DNA testing and also people above 30 years. We do HPV DNA and also VIA. So with my end, mostly is VIA that is done because of financial constraints. It's few people that are able to pay for HPV DNA testing and pap smear. But if a patient needs colposcopy to be done, colposcopy is captured by health insurance, and so with that, they don't pay. Or if a
Oh, okay.
patient, yes, it's captured by insurance. And also, if a patient need an excisional ablative treatment, that is where the patient will also pay for some portion, and I think health insurance also pay for some portion. So these are the treatment options we have, and the year that we start screening is above 30 years, but sometimes below 30 years. And so if a patient tests VIA positive, we either do ablative treatment or excisional treatment for the patient, then follow the patient up after a year with HPV DNA testing for the patient. Then also if there's a suspicious service upon trying to do VIA, we take biopsy instead of doing the VIA. Thank you.
Okay. Thank you very much. Thank you. Mousy, are you
You're
ready to
welcome.
share? Or you having some challenges? Okay, as Mousy is still working on that, family midwife, I want to find out that beyond cervical cancer, what are the other HPV related cancer and conditions? that healthcare providers should be educating our patients about in men and both women? Because I've heard that there are other cancers that HPV can cause, like even breast cancer, right? Family midwife or Vicky? Hello, can I be heard?
Yeah, hello.
Yes.
So yeah, so aside that, we know that the HPV can also cause the. I mean, I think we have even mentioned it proper in this discussion. Can cause the penile cancer, the anal cancer, the neck cancers, the throat cancers, sometimes even the head cancers. Yes.
Oh, can it also
The
cause
the breast
oral cancer?
cancer, yeah, I don't know. I know that one. I haven't heard of it.
Oh, I asked the question. I don't know whether you heard me. I was asking about oral cancer too.
Yes. So that's what I said. The throat cancers, the tongue
Okay.
cancers. Yes. So the oral cavity too, because of the oral sex. Yeah.
Okay. Okay. Family midwife. Okay, Sidonia, are you with me?
Yeah, I'm there. I
Okay.
saw what Gifty has said. That's why I've not said anything.
Okay. Okay.
Yeah.
Okay, so Sidonia, what are the key barriers to HPV vaccine intake that you have encountered? I mean, you've been going for the awareness creation in the communities. What are the barriers that come up? What are the concerns that the community, raise when it comes to HPV vaccination?
So usually, or what has happened recently, and from lessons we have learned from the past, usually is the understanding the myths. But what now we do is break it down into the local languages for them to get the understanding. So
Mm,
yeah, apart from the language barrier, which they may not have understood the meaning of what you are trying to explain to them, and then probably the myths that you have to demystify. For now, I have not come across any difficult challenge like that in my area.
okay. So I have some contributions in the chat. Ethel, hi Ethel, we can see you. Ethel says the HPV can also cause what do you call it? Vaginal cancer and vulvar cancer and all that. So I think HPV it has its own, I think it has been underrated for a long time, and we pay much more attention to HIV virus without, you know, keeping an eye on this. So Anne, I want to ask, what role can health workers play in advocating for broader public health policy related to HPV prevention and education, especially in your context where, I mean, it was done when you were young? What has been it? It seems for you guys, it's like part of your national something that is being done routinely for everybody. What do you think is the role of health workers in advocating for broader public health policies related to HPV prevention and education?
Great question. I think education is the biggest thing, and what I often see providers do at hospital checkups. So when the moment when you have a child, and you take the child for their first appointment with the pediatrician or the family doctor, they educate the parents. Okay, we have this vaccine. We have this. You start educating them early so that they are aware.
Mm,
Yeah, early. That way, by the time it gets to that stage, it's something that they've heard before. They may not remember all of the details, but it's something that they've heard before. And most likely they will hear it maybe, when people do these various outreach trainings in different communities and whatnot. I think the biggest thing that healthcare workers, can you hear me?
yeah.
Yeah, the biggest thing that healthcare workers, providers can do is education, because if they are not aware, then there's not much we can do. I'm not sure about in Ghana how the system works, like the how do the public health nurses work. I know, Sada, we kind of talked about it briefly one time, but I'm not sure how they usually work. But I know here in the States, we have public health nurses, and they usually work in the community in
Mm,
underserved um, populations. And as you guys can see, Kweku Trump, who has come on, has cut a lot of funding, because the public health nurses get paid through this governmental funding and stuff. They usually work with Department of Health in different states depending on where they live. And so the biggest uh the biggest way that people can get education for the general public is when they go for their general appointment. So even if you are a midwife, even if you are caring primarily for the mom, you know that she's had a child or she has children, and she may, even if it's just boys or girls or whatever, you educate her and let her know, hey, you are a woman. Maybe, yes, in her time she didn't get the HPV vaccine, but you let her know, oh, this is the new thing that's coming up. I know you have daughters, or people who have daughters, you have nieces and of those things, and nephews. So, this is something that has come on. Let your people know, or you bring your daughters in, or to get the vaccine depending on what age they are in. So I think the biggest thing is education in all arenas. Don't think that maybe you work in, I don't know what kind of example, but you work in a specific section, and you don't necessarily give HPV vaccine. So education doesn't rely on you. And that education helps. Even if you are the one who would not give that vaccine, you can direct them to someone, or you can even just letting them know would allow them to go to whoever their primary care doctor is, to go and inquire about the vaccine. So I say that the biggest thing is education, making people aware, because I'm sure now that this is something that is become a national thing in Ghana. There are people who have not heard of it. So education is the biggest thing. That's my input on this.
okay, all right. Thank you. And this is to Comfort. Comfort has done a few research. I mean, she's very passionate about this. I want to find out from Comfort, in what way is the HPV research evolving, particularly in the area of male HPV? Because I think it started with female, but now we notice it's gone all the way to the men. How and in what way is research evolving in that context? Comfort, can you hear me?
Yes, please, I can hear you. Can you hear me? So,
Yes.
the HPV, the test that is commonly done now is only for female. it's only female because the male penis, what are you going to screen on? You cannot take a sample on the penis to go and do HPV test on. So currently on the penis, there's no HPV test going on for now. The only thing that is going on for now is about the tests. I think last 2 months I attended a webinar on the IPVC, the international, and they were talking about sampling of the anus. So they are thinking of bringing a new brush. So there's a new brush that can be used to take anal sample for DNA testing, HPV testing. And then for the truth, yes, and then for the truth for orophageal cancers too, they're trying to get a brush that can take sample in the truth. If somebody presents with any signs or symptom or anything, so that they can take sample in the truth. But I remember that UGNC, I took a sample for somebody in the throat before, just using a cotton patch, right? A cotton swab to take a sample in the throat. But the anal, the IP, they are now trying to get a brush that can take anal sample for cancer. For male, the penis cannot be screened for now. I don't know whether we are going to wash it and take the wash test for it or what, we don't know. So the worst we can do is maybe to apply acetic acid on the penis to see, because it has been done before. You apply acetic acid on somebody's penis. There's a small lesion that has shown that, like whitish patch on it, we show that there's a lesion. There's a lesion on the penis, yes. But to do HPV DNA test for male penis, no, I have not started the profession. But for the truth in the anus, now the development are coming so that the brushes should be out for the taking out for the.
Okay. All right. Thank you so much. So now we're coming down all the way to why this vaccination is going on. Just a few tips for any mother, any parent. Okay, the government is rolling out this, and it's starting from the 9th to the 14th, I think, or is it? Yeah, 9 to 11 or 9? Yeah, 9 to 11, they say. So they are going to do this for the length of time, and they are hoping to reach a lot of girls. Okay. After this vaccine is taken, is there any immediate like side effect or this body reaction, like the way when you take maybe tetanus injection, you have maybe after 24 hours you can feel this numbness and pain? Is there anything that people should expect? Or for HPV, you take it and nothing happens, not like the other vaccines? Anybody can answer this one? Because I have not taken it before, so I don't know how it feels.
I would say like the soreness of the injection sites. Well, it depends on how the technique, the person who is given the injection, making sure that they give the injection well in the right spot. But just some soreness. Usually when we get vaccines, I don't know if you guys experience that, you feel it kind of crawling up your your arm and neck a little bit. So it should just it should just be some soreness on that arm, for probably like 24 hours. But like I had stated earlier, there are some people who have experienced dizziness, fainting, because of the vaccine. But those are like rare. So that's pretty what I've known. But it hasn't shown that so many people have gotten any adverse reaction.
Okay, let me come back to Ghana. Vicky, Sidonia, Comfort, family midwife, Gifty. Have you had anyone saying, or maybe after, or some of you that have taken it, did you experience anything after, like injection site pain or anything?
Director, my line
Yeah.
went off for a while, so I had to rejoin again. Please, the national HPV vaccination is rather from the 7th to 11th, not 9th to 11th.
Oh,
So
okay,
kindly
7 to
make that
11.
correction.
Okay.
Yes, please.
All
And
right.
yeah, the vaccine, apart from the pain that I had, I didn't feel anything again. And I also haven't had any reports coming from those that I know that went for it. So I don't know if there are others that we know of. Yeah. But then apart from the suspected headaches and maybe a slight pain and where the injection was given, I don't think there's been any adverse reactions so far. Yeah. So um that is it. Thank
Well,
you.
I think even as tiny as they are, probably we should mention it so people get to know these are the normal ones that you could feel when it comes to vaccine, you know?
Yeah. Yeah, yeah. Yeah, I think, and every child is afraid of needles. So I think the earlier we let them know, every child is afraid of needles. Like taking the injection
Yeah.
itself, it's not going to be an easy thing. But if you let them know that
Mhm.
at least they'll, it's not like they are giving the injection. So yeah, yeah, there will be a prick. Like you feel it. Maybe not so much, but then I think we have to let them know that so that they would be prepared for it as well.
Okay. Vicky, Comfort, Gifty, Sedonia.
So with this vaccine, well, I have not encountered any major side effects, seriously. And I think everybody on this, or those of us in Ghana, kind of. So I think when they roll it out, actually, since it's going to be a mass vaccination, then we can actually pick if some people will have some adverse reaction or what. But then I think the general signs and symptoms or the general effect that we will get when we take vaccine, yes, that one is to be, if you get it, then it's to be expected, like what everybody have mentioned. I don't want to repeat it, but the general sign effect that you feel when you get vaccine, sometimes you can have some slight raise in temperature, which should go within 24 hours, pain or something. Yeah, where that one we even
Okay.
advise them, okay, if you have some pain, you can use cold compress or warm compress, depends on how it feels. If it feels warm, you apply cold compress and vice versa. Other than that,
Mm,
I haven't come across, I have friends that have taken it, nobody complain about anything. Thank you.
okay. Awesome. Then I think now I have the courage to go and take the vaccine. Okay. With the national one that is ongoing, we know that the target is from 9 years to 14 years. I want to find out, why do we think the government? Okay, Comfort, are you ready to share? I can see you're trying to share your screen with us. I think probably you have to share the whole screen since it's coming up this way. Or would you mind sending it to my email so that I share it here for you
Yeah. I think I should do it.
in case you're struggling with it? Yeah. Okay.
Okay.
Okay. So yeah. So as I was saying, I wanted to find out how effective the vaccine is for, I mean, our girls that are coming up. And is it too late for older girls to take it? Because I'm happy I'm hearing that some of us have already taken it. At what age did you take it? Is it advisable for the older ones? Because I think almost everyone on the life is older, and they would probably want to, like me, I want to go and take it. I know it is good, but is it too late for older girls and women to get it? And how effective is the vaccine in case you take it between the age of 9 and 14? Victoria, Sidonia, Gifty?
So I think this one has really
Director,
been mentioned already by Comforts and so many other people. So so it is known that when you take it earlier, because at that time your immune system, you are strong enough, your immune system is high. I mean, it's going to actually work and give you the immunity that you need. So it is very, very important that, I mean, they are getting it earlier, because that is where they have stronger immune system to actually build immunity against this virus. However, when you are also older, like us, it is not too late, because when you go and test and you are negative, you can take the vaccine, and the benefit obviously outweighs the bad effect. So yes, I think that's it. Somebody can add up.
Okay. Family midwife.
Director. So, yes,
Yes.
the government is targeting 9 to 14 years. And as said earlier, you know that, as Sister Vika said, it's the best time for a sexual debut. So it ensures long-term protection. So, like, let's say, for example, maybe a 10-year-old girl is vaccinated, will gain a lifelong protection against the cervical cancer. And how effective will?
Mm.
Yeah. So let's say you were asking if older people too can. We have already said that the HPV, if somebody has some of the infection already, you can still take the vaccine. It's protecting you against other strains of the HPV virus. So yes, you can
Mm.
take the vaccine as well. For me, I took it before my sexual debut, even though it was later. Yeah, we went for a conference at Takwa. Then time it was a general nurses group. I don't know if that group still is around.
Mm.
Yeah, we went for a workshop. It was in 2010 or so. When we went, they came with
I
several breaks and was it and a particular, yeah, they started advertising. That time it was 900 cedis, and 900 cedis was a lot of money then time. But from the way the doctor was able to do the
Family
yeah.
medicine is still a lot of money today. Oh.
yeah, so like that man really scared me anyway. And that was when I started getting the interest in women's health and cervical cancer. So when we came back, it was only at CAT, Confanochi, that you can get that drug. But the struggle that you will get through to get a drug near, it wasn't easy. So I don't know. I just pulled something or but I just went for it. Yeah. And I took 3 doses. But I
Mm.
didn't think much about it. Yeah, at that time. I think
Wow.
I was 24 years then. Yeah, I was 24 years then. So I took it.
Oh,
And
okay.
so that was from my personal experience. Yeah. And the
Yeah.
screen
Mm.
later that
Mm.
I learned that you have to still do the screening. So most of us were not really informed. And so now that we are learning, we noticed that there were things that we didn't know, but then we are learning along the way. And so it offers the protection. And if it's not effective, I don't think it will be here. And luckily enough for us, our
Yeah.
people are taking it. Director Anne has taken it, and it's normal and a routine thing there. It's just that ours is not like that. And that is why, though
Mm.
it's already,
Yeah.
no one was aware. And that is why the advocacy is now coming in, the awareness creation and all these things. So in as much as some of these myths will come in, I think we are doing a better job in educating everyone that it is not just so HPV vaccine has been there a long time, but we are now making more of the awareness because of what we are getting and the results that is coming in getting cervical cancer and all sorts of that. So, Director, basically, that's what I can add up to what has previously been said.
Yeah.
Yeah.
So I want to
Okay.
also
So I want to find out how much we are wrapping up. How much is the vaccine now?
I think some cost around 1,000, 2,500. I think that's the range. It's quite expensive. It is. Depending on the brand also. I think Star Comfort can help us.
Oh, wow.
Yes.
Yes, and then so I want to find out the price, and then also, in case somebody is going, are they looking at? I mean, the type of vaccine are they looking at?
Okay. So the vaccine that is in the
Comfort.
now is Gadasa 4 and Gadasa 9. So some facility have both Gadasa 9 and Gadasa 4. So I think the maximum Gadasa 4 should be about 1,000, depending on the facility. My facility has 1,006, and then the same Gadasa 4, the facility have 1,002. But I got this 9 is 3,000 Ghana,
Okay.
which contains 7 of the high risk and 2 of the low risk. That is 3,000. And the Ghana 4, which have
Wow.
HPV 16 and 18, and then low risk 6 and 11, yes, 1,000, 2,000, 2,000.
It's quite expensive.
Yeah.
Oh,
So how
we
can,
should
how
really-
can people vaccinate?
yeah, how can people vaccinate? It's not easy.
Wow.
Pay for
And
HPV
then
testing?
with the prices that has been mentioned, with the price that has been mentioned, is it for just a dose or the whole 3 doses?
Please for
I
a
think
dose.
it's for a dose.
That's
Oh,
why.
so if I want to get vaccinated, I'm looking around 5,000 Ghana cedi
Yeah,
No,
for.
if you are going
that's
for
a four.
the 3,000, that means 9,000. If you are taking 2 doses,
Oh.
because I think she said it's 3,000.
Mm.
Yeah,
Yeah.
that's the non-valent also. Yeah.
Wow.
Yeah,
Wow. Wow. That is quite wow. That is, yeah. Somebody has typed in the chat that that is too expensive for an average Ghanaian. So at this point, we wish we were all between the age of 9 and 14, so that
Exactly.
we can have it for free. Yeah, because it's fairly expensive anyway. It is expensive, but it is also necessary that we get it right. So I have some myths that even when I posted this, I spoke about cervical cancer, it came up. The first myth that I was told by somebody that immediately you okay, anyway, the first one is that they say if you have HPV vaccine and you should get into you even before whatever, it can cause infertility. So I want to find out, is it true or it's a misconception? Anyone can take it. I have
Okay,
about 3 myths.
I'll use
Another one
myself.
says, so, so
I'll
let me
use
drop the
myself.
myths and then
It doesn't cause infertility.
okay.
No, it doesn't cause infertility. So I'm
Yeah.
here. I'm here. This one day, I'm feeling. I took it, as I said, when I was 24.
You are living testimony.
Yeah, I'm a living testimony. So it doesn't cause infertility. But there were some videos that were circulating, I think a year ago, about is it a Rwanda president that the vaccine has been actually manufactured for African something something something. I have a video in there. That's how come people got to know that the vaccine causes infertility, and he was saying that they want to reduce the African race, and so we shouldn't allow it, or that kind of thing. But then, if you look at what we have discussed so far about HPV and what is really causing the complications and the deaths, no, there have been researches going on. There are people out there that have taken the vaccine and they have given birth. Infertility is a whole topic on its own, and there are several factors that causes the
Yeah.
infertility. It's not a vaccine or no. And from the
Yeah.
data, I don't think any research has come out to say this is what we gave this dose to HPV vaccine to this group of people. They were able to deliver. They were able to get pregnant, or they were not able to get pregnant. Fine. And so, please, that myth is something that is not true. It's not really true. And so, it's not going to cause anybody to be sterile or infertile. No, that is from my end.
Okay. So somebody is asking in from our Facebook live. The person says, so is it the 9 to 14? Will they be giving the 3 doses for free, or is it only covering the first shot?
Hello.
Please, our representatives, can you help us? Comfort.
Yes.
Yeah.
For now, since the introduction of this vaccine from 2006, they have been how will I say evolving. They have steadily showing because people cannot pay for the 3 doses and all that. So in 2022, WHO know they are involving the vaccine. So now to have herd immunity, which is half loaf of bread is better than that. One dose even give immunity. So now, even if you have one, if you don't have the 3 doses and you have one dose, because they are improving upon the vaccine as it goes. They are always improving every time. There's improvement every time. How do we see the effectiveness of it? Which way will it be effective? Now they started from 3 doses, started 2 dose came, even for HIV patients, 2 doses came, and now we are in single dose, so that you can have herd immunity, so that you'll be a little protected. So now the efficacy of 8 single dose. So our children now will be having at least one single dose.
Oh, okay. So the one they are giving them is just one shot, and that's it.
One shot. Yes.
Okay, okay, that's nice. The next question here is that will they be going to schools for
But
vaccination
Mousy,
of our girls?
Mousy, the one shot is it going to have a lifetime protection? Because technically vaccines, we know that they have duration of coverage. So I don't know whether you have some information about that. And I want to also hear from Anne, maybe how they did it. She take it once, or she has to take it 3 times, or something like that.
That's why I said now the current vaccine we have now is efficacy for it to be effective. If you take one dose, you are still protected. And it doesn't have booster. You don't go for booster. It's a lifetime protection.
The time that
Okay.
I had the vaccination, it was one dose because that time was it, I won't say it was fairly new, but that's what it was at that time. But then now it has evolved, so it has more.
So
Okay.
Yeah. So
it's
at
still
my
one
time,
dose,
yeah, at my
no
time it was one
booster.
dose. Yeah.
Okay. Okay. And then another question here was about the schools, and I think I had information earlier, so I can speak from the letter. They are going to go to the schools, and then the hospitals too are going to be open for the vaccinations, so we can take our girls there, or they can have it in school to make sure that they've gotten, the vaccines and they are protected. Sabi says, can the adults Okay, so somebody wants to find out this vaccination that is given to the girls between 9 and 14. Can an adult also take it? Or these are meant for probably those who are not sexually active or something? Are the vaccines different? Gifty, Angelina, Mousy, please let us know. Are they different or is the same vaccine?
Please, it's the same vaccine.
The same
The
is
same
the
vaccine.
same
Oh, I see.
vaccine.
Oh, okay, okay. All right. So Sabina, they said it's the same vaccine. Eunice is asking a question here. If you tested negative for HPV as an adult, can the free vaccination still protect you?
If you test negative for HPV, then you
Yes, as
qualify
an
to take
adult, can the
the
free
vaccination as
vaccination
an
still
adult.
protect you? I think
But
it's
the
a yes,
free
right?
vaccine is not. The
Oh,
free
okay.
vaccine you are not covered. It's for only those from 14 and 9 to 14 years. And even a communique is going around. Anybody that is seen to give the vaccine to an adult or even sell one, you face the full rigor of the law. So the communique is going around.
Okay.
Even if you
So
are the
please,
one who is giving
it
it,
is not for
if you are
adults.
the person, yes, no problem.
One from Mustafa and one from Florence. What are the questions? So Mustafa says,
Gifty,
good evening.
I'm getting a feedback from your side.
As emerging leaders in our respective professional spaces, particularly
Hello,
when
Gifty.
we find ourselves in situations where institutional heads
I
consistently
would have to probably mute you. Okay, she's done it herself. Okay. Yeah. All right, Mousy, I have your stuff here, so I'm gonna play it briefly. I have just few minutes and we are gone. Where is it? Okay, so this is it. I think you would want to talk about it. Yeah. So I think these are what you wanted to show. Do you want to talk about it briefly so we wrap up?
Okay, let me have the other two first.
You want the other one? This one?
Yeah, okay, yes, okay. You
Oh,
somebody's like on. If you could be on, if you on, go ahead. So your question was you wanted to know if I can project a normal service and then the service that have a that has a pre-malignant base.
yes, please.
Yes. So the two atlases that we have is actually one atlas one, but we have front and back. So you see that there's one of the atlases. I'm not showing, so maybe you. The ones that have there's nothing white on that one.
Okay, let me see. I hope I got all of them with me.
Yeah,
So
yeah.
let me,
I have the yes. This one is okay for now. So um the
oh,
one that
not this one.
no, not this one.
A minute. Is it
Okay.
this one?
Yes, this one. You see
Okay.
the pictures that are on this one.
Yeah.
Is everybody seeing? Okay.
Yeah.
You see the first two up there at the left
Mm-hmm.
corner.
Mm-hmm.
They are normal sets. They are
So
all
all
this
these
is
are
normal
normal
sets.
sets.
All these are all normal sets. These are all normal sets. These are all normal. And then the other side, the one which have some whitish patchy things, some burnt things and gray on it. That one,
These
the other side
ones.
of it.
Oh, here.
Yeah, there are two. One, everything is good. There's no white patches. There's nothing there. Then the other side, we have the cancer at the side, and then Can you see the one that the service has some white patches on it?
This one. Can you see the screen? Because this one has some white patches.
Yes, I'm seeing the screen. There are two. There are two here. One at the right. Okay, this one. This is the one that is a pre-malignant lesion.
Okay, so this one, this same one.
This one. Yes. So you see that the below, you see that there's some white patches on somebody's cervix here. Yes, yes. Where the cursor is, yes. So these are pre-malignant lesions. Actually, this woman would have gone home if we were not to do a visual inspection. So when we take a sample on somebody's cervix, like the first part that is gone, if you take a sample and the person gets up and leaves, you will never see a pre-malignant lesion unless you do a visual inspection method, which you have to use acetic acid and apply it on the cervix. Because when you are taking the cells, it's only discharge you are taking, the person gets up and leaves. But immediately you put acetic acid on, or you put a logos iodine on, something will pop up and show that there's abnormality of the cells. That is why I was talking about HPV. From 21 years ago, we can do half and GIA or half and visual inspection method. And anybody who will do pap smear in HPV sampling should also do a visual method, because you will never see a pre-malignant lesion if you have not applied acetic acid or glucose iodine.
Wow. Okay, thank you all so much. I think we've exhausted everything. We've spoken about how, already Sidonia has spoken about how they do the education and get everyone involved. So we'll be leaving with take-home messages about the vaccination. Let me start with who? Let me start. Okay, so since Comfort just ended, I think I want to start with Comfort. What will be your take-home message for everybody listening to us concerning this national vaccination?
So our take-home is that we should endeavor to educate the public so that they make their girl children available for the vaccination. And also, we should try to do HPV DNA testing before giving vaccination to adult women. To add to that, we should endeavor, if you are a screener here, try and add visual inspection method to the screening that we are already the HPV and FAP. In that way, we'll be able to see pre-malignant and treat them. Thank you.
Thank you very much. Victoria?
Okay, so my take home is that we should, as healthcare workers, we are kind of, because of the work that we do all the time, we are hearing these things. So we should spread the news on our WhatsApp platforms, Facebook, all our social media handles. We should continue to spread the news. We ourselves too, we should continue with the screening. I have so many friends that they haven't even done the screening. I don't know, maybe it's fear. Yes, I understand. So we're encouraging ourselves too that we should continue with the screenings, and if there's anything we can quickly get treatment for. Our mothers too, that our children luckily have gotten the opportunity to be vaccinated. Please, it is very, very, very safe. It is, in fact, I am a living testimony. It is very, very safe. Let's go out in our numbers for our children to get a vaccine. Thankfully, they have gotten the opportunity. We didn't get opportunity, but that is okay. They are children now, so yes, we want to protect them. So yes, that would be my take home. Thank you.
Thank you. Oh yeah, who's next? Or anyone can come in.
Okay, so HPV vaccination, which is coming home, this is a take-home message that we are giving to everyone. We are grateful for those online, all the social media handles watching us. And my take-home message is HPV vaccination is just to protect against the virus that causes cervical and other HP-related cancers. Again, the vaccine works best before exposure. That is why we are targeting the girls aged 9 to 14 years. And then also, if you are older or sexually active, the vaccination can still help protect you from other HPV types that you haven't yet encountered. And so we are urging everybody that please take your young girls for the vaccination. And remember, vaccination plus the screening offers double protection. We are so grateful. Let's educate our sisters and our dear mothers as well. And we know that this campaign will be fruitful. Thank you, everyone.
Thank you. And
I'll say everybody pretty much said it all, but the biggest thing I'll say is please get tested. Go for your pap smears. Yeah, because if you can get the vaccine all you want, and or take your children to go get the vaccines, but if you are not getting tested, especially if you're someone who's sexually active, um, you know, we still there can still be a diagnosis or something that's not seen. Yes, it's a vaccine. The goal is to protect, but nothing is 100%. So getting tested, going for your checkups is very, very, very important. Thank you.
thank you, Gifty.
Hello.
Hi.
Hello.
Yeah, Gifty, we can hear you. Your take home message.
Okay, so please, what I want to say is that um, if you are infested with a virus, it is not a definite. Um, it's not definite that you are going to get cervical cancer. And also, if you are infested with it, it is not your partner, or you can't vividly or emphatically say it's from your partner that you had it. And also, every woman who is sexually active should try your best and go for your screening. And also, if you are negative of the HPV test, try and go for your vaccine. And also try and take your girls to any facility, public facility, where you hear that vaccination of HPV is being done. Please take your girls there to go and vaccinate them. Thank you.
Thank you very much, everybody. I'm so grateful for this section, and I thank you for your time. Thank you to our viewers who watch us and the like and the questions. We're hoping that this national vaccination will go a very long way to benefit all the girls, and then we will also get tested and be able to prevent these variety of cancer from getting to us. So a very good evening to you all. My name is Ada again on and one online. Okay. All right, guys. Thank you so much. Bye. Good night. So I just stopped streaming. So the streaming has stopped. Thank you, everybody. I'm actually going to work.